A stark warning from the CDC tonight. The worst of COVID-19 might still be ahead. In fact, the CDC's director says this winter could be the most difficult time in public health in the history of this nation. And this comes as the United States sets two alarming records, surpassing 200,000 new infections in one day and topping 100,000 COVID-19 patients hospitalized at one time. The CDC is now saying that people exposed to the virus can quarantine for a shorter period of time. Federal recommendations cut that time in half under certain circumstances. The Centers for Disease Control says people who have been exposed to the virus can end quarantine after 10 days. That's if they're symptom-free. The quarantine can go to 7 days if you don't have symptoms and you test negative. The CDC still says 14 days, though, is the best way to reduce the risk of any spread.
To help us understand why the recommended quarantine period was shortened is our medical expert, Dr. Arnold Baskies of the Global Cancer Control Advisory Council. Dr. Baskies, thanks for being here again.
Good evening, Jim.
So does this make sense to you? If you're not showing any symptoms, is 7 days enough to say you're good to go, or is there a risk you could still spread the virus?
Jim, there's always a risk that the virus can be spread, but the data that we have was based on information we had for a disease that was brand new. So the safest way to approach it was to take the worst case scenario, which is that 2 weeks gives you the maximum amount of time that somebody can be carrying the virus and not become symptomatic and spread it. But now it's very clear that it's relatively safe to quarantine for 7 days rather than the full 2 weeks. And the reason for that is very simple. The majority of people who are going to become symptomatic will do so within 5 days.
All right. Does this change any of the recommendations around holiday travel, or should people still say, I'm going to stay home instead of visiting loved ones?
The safest approach is not to travel. We're going to have a big problem, and we're already seeing that in most of the major cities around the country. If you follow the transmission rate of the virus, it's going up. This is the season for this virus. It loves this type of weather, cold, dry air. And that's what makes this virus so rampant and such a big problem, is that people are traveling at a time when the virus is multiplying.
Thanks, Dr. Baskies.
Thank you.